Hello, my name is Christopher Walsh, and I am a DO PhD student from Ohio University. Today I would like to present to you my study on the effect of lymphatic pumping technique on tumor growth in a mouse model of metastatic melanoma. This experiment hits home for me because I am working my way towards becoming an osteopathic oncologist. However, there is a paradox in becoming an osteopathic oncologist, and this stems from disagreements in the literature about how physical touch affects cancer. On one hand, there is the thought that manipulation can worsen cancer care. This is supported by two studies published in 1969 and in 2014, which found worse outcomes in patients who received manipulation. Their hypothesis for this observation is that the physical movement around the tumor increases local fluid flow, which increased the spread of that primary tumor they were studying. On the other hand, there is the belief that manipulation can improve cancer care. This is supported by studies that have found that OMM improve pain, quality of life, and side effects from chemotherapy in patients with cancer. In addition, the fluid flow hypothesized to cause metastasis is the same flow that activates the adaptive immune response, a system of our body we know has full capabilities to kill cancer. So where does this leave the osteopathic oncologist? Well, the fourth edition of Foundations of Osteopathic Medicine advises against techniques that manipulate tissue near the tumor or that enhance lymphatic flow. For many patients, this is sufficient, but what about those unlucky many that will present with advanced metastatic disease? People like my first patient to die from cancer who presented with melanoma in her brain, bones, lungs, and liver. According to Foundations, she would never have been a candidate for manipulation, but I question if that was truly the best treatment course. This is a dilemma that inspired me to look into how manipulation can be used in oncological care. To address this, I designed an experiment to test how the most aggressive fluid-moving technique, called lymphatic pumping, or LPT for short, affected tumor growth in mice with metastatic melanoma. Here you can see the lymphatic pumping sequence that I used. This consisted of a 1-minute soft tissue massage, 1 minute of thoracic lymphatic pumping, 1 minute of abdominal lymphatic pumping, and then another minute each of thoracic and abdominal lymphatic pumping. I performed this every day for 7 days, inoculated the mice on day 8, and then performed this technique every other day for the following 21 days. At the end of the experiment, the mice were sacrificed and their tissues were analyzed for tumors. Surprisingly, we found that mice receiving lymphatic pumping technique had less tumors than those which only received anesthesia. We use specialized melanoma cells that express light so that we can accurately measure tumor cells, opposed to simply counting them. And this is the reason why you see luminescence in these graphs opposed to tumor burden. Although we were very excited by these findings, we knew that, like many other preclinical cancer studies, this study's design was flawed. We used 3-month-old healthy adult mice in our study. These are equivalent to about a 25-year-old human. However, we know that cancer is generally a disease of the elderly. So in an effort to test LPT in a more clinically relevant model, we repeated this experiment with 20-month-old mice, or about a 65-year-old human. The results of that study can be seen here. We unfortunately did not see the same beneficial effects of LPT as we did in the young model, although we were very happy to see that LPT did not increase tumor burden in these mice. In summary, we found that increasing local fluid flow around a tumor by using LPT did not increase tumor growth or spread in metastatic disease. In fact, we found that LPT decreased tumor growth in the young, healthy animals, and although we did not see this beneficial effect in elderly mice, we were delighted to know that LPT did not increase growth or spread in those animals. Our study suggests that LPT in osteopathic manipulation as a whole could be safer than what was previously thought in cancer patients. And for my concluding remarks, I would like to emphasize that this study was for metastatic disease, the side of cancer with the worst outcomes, least treatment options, and most amount of suffering. These patients need more options, and maybe osteopathic manipulation is a route to increase the efficacy of standard treatments while reducing symptoms associated with them. And lastly, a big thank you to all the people and organizations on this slide, especially at the Kopchik Lab at the Edison Biotechnology Institute, everyone at the Translational Biomedical Sciences PhD program, and of course, the Heritage College of Osteopathic Medicine. Thank you.